Hello, this is David Oliva, and I'll be doing the wrist taping. This is my injured athlete, and unfortunately I cannot procure a live specimen, so this one will have to do for now. Overall, what you're going to do is you're going to put on that the pre-taping wrap, and overall you kind of just want to get the just to the mid part of the actual forearm, and then you also want to get the thumb right here. And just taping the wrist essentially, and then that's good right there. We get the rest here. Then overall, kind of just do that. And overall, what happened is that the athlete landed on their wrist and thus made a wrist hyperextension sprain injury. And this is common with athletes who fall onto their wrist. And put a lot of force onto their landing, unfortunately. So overall, what you're going to want to do is take your tape here and just make what you call anchor points. And you're going to want to start at the mid part of the wrist. There we are. Okay. And then next, you kind of want to do the same here, essentially. There we go. And then also, you want to do in the inner side of the wrist here, and move their thumb. Give it up for my specimen here. She is doing a great job. And overall, you're going to want to make anchor points. And then once you get to this point, you want to measure out from the lowest anchor point, starting point, to the upper part of this anchor point. And you want to get the tape and essentially measure it from the bottom portion to the upper portion there. So it's right about there. And what you're going to want to do is take tape, and you're going to make a fan. And the purpose of this is to prevent hyperextension from happening anymore. So you want to take 3 pieces of tape, measure it. Okay, it's right about there. And then cut that off, essentially there. And I'll show you how to do a proper fanning for your tape. And overall, what you're going to do is you're going to do a little bit of, you're going to have your patient do a little bit of wrist flexion, in which the wrist is going to go down like that instead of extension. And the reason why you want to have the patient do a little bit of flexion first is because you want the taping to prevent additional hyperextension. So overall, you're going to take it and you're going to fan it out as such. Like that, and then take this tape and then put it in the middle right there. Ooh, okay. So overall, it's going to be a fan, and you're going to want the patient to do a little bit of wrist flexion. So you can move the wrist down as such, and then you're going to take the tape and tape it while the wrist is a little bit flexed but not too much, and then tape it like as such. This right here prevents the actual athlete from doing hyperextension, because as the tape has been pushed down in the wrist flexion, it's going to hold that position more sturdily. Once you get to this point, you're going to want to tape again. Make sure that fan is locked in place. Also, of note, you want to do about 2 or more fans. Depending on the severity of the injury. I only did 1 for video purposes and the time limit. But overall, you want to do that so it just reinforces that strength. Because the more tape you have on the patient, the more the ability it's going to hold that position. And then, there we go. And then right here. And then essentially also you want to do some additional taping between the thumb. So you can go right here, wrap around once, and go through the thumb as such, and then Once you get there, you're going to want to go ahead and anchor that point. And you can do that a couple times as well. And lastly, you want to get the last top anchor point where the fan was taped down and go ahead and secure that with more and more taping. And essentially what this is going to do, the taping's now been done. Since the fan is there locked in place in a slightly flexed position, it's going to prevent the wrist from going all the way to hyperextension. And since the athlete had a hyperextension wrist sprain injury, this type of taping is good because it prevents the athlete from hyperextending the wrist again. All right, for the rehabilitation, overall what you're going to use, you're just going to use rest, ice, compression, elevation, RICE treatment for the treatment option. And I'm going to go over you today with the rehabilitation process of strengthening, because it's recommended that strengthening exercises are done immediately after the wrist sprain injury has been confirmed by your palpation, whichever test you choose to use, or based on the symptoms of what happened by a mechanism of injury. So overall what you're going to do is essentially you can grab a weight, if you will, as such, and overall you're going to practice 4 sets of 10 to 15, depending on which type of range of motion exercise you want to do with the wrist. So essentially for wrist flexion, you're going to take the weight and kind of just move the wrist as such and kind of get a flexion motion started. And you can do anywhere from 10 to 15. You can start on a lighter weight, this is 5 pounds. You can go to 2.5 if you like. And once you do that, you can also go to grab it like this. You can do wrist extension as such. And also you can do another exercise for more range of motion, which is going to be radial deviation, as you're going to move the wrist outward, if you will. And then ulnar deviation, you move the wrist inward. And again, you're going to do this for multiple sets. You're going to want to do about 2 sets a day, 3 times a week. And you want to keep doing this and increasing the weight per week until you gain full range of motion and until you're pain-free.